Greetings and welcome to the presentation titled Fabrication Workflow for Additive Manufactured, Solid and Lattice Structured, Titanium Alloy, Dental Implant Overdenture Bars. Quite a mouthful, but we'll see how everything fits together. I'm coming to you virtually, but I reside in Canada. I'm an assistant professor in restorative dentistry. And when we start talking about a little bit of background and we talk about restoring a completely edentulous arch, we know there are a lot of treatment options out there. And one preferred treatment option is the implant bar. And we were very fortunate to do a 12-year follow-up on one of our patients. These are the actual clinical photos. And we can superimpose the photos on radiographs as well. And what we can conclude is that it's very predictable, very successful. And in the right hands, it's a great treatment modality. And we went ahead and published that data. And with the proper case selection and in the right hands, it's a great treatment option. As we move forward into today's day and age, we can then couple that with zirconia, and the bar can be designed in a way to compensate for implants that are not perfectly parallel. So I think we're all aware that implant bars now are manufactured through milling, which is a subtractive manufacturing process. And there's an example, and then it fits on our working models as we see. So this investigation was looking at, could we do this with additive manufacturing and incorporate the lattice structure? So the solid implant bar was quite simple, but the lattice structure took quite a bit of designing, and we had to have the drain holes for the power to come through. But what we found is we can actually use additive manufacturing with all those positive advantages for the implant bar. This also coupled very nicely with the iVotion denture so that we had a great fit. So we can really jump to the conclusions and see that the implant bar, whether it's solid or lattice structured, can be fabricated through AM. They have very desirable features. Reduction in cost, reduction in time, reduction in workflow, increased accessibility, increased sustainability, and now we're seeing that we have very desirable physical properties as well. And this kind of bridged the gap that we didn't have to see, can we utilize this with implant bars? And what it does is it gives dentistry yet another option that we can provide for our patients. And last but not least, with accessibility, more patients can have it. And if we're talking sustainability, it's win-win for the planet. So thank you very much. Please reach out at ljkalman@icloud.com if you have any questions.